My name is Jobe. I work with the Malawi Health Equity Network as the Executive Director. The Malawi health sector has a number of challenges. For example, we have inadequate numbers of health workers, that includes doctors and nurses. We have inadequate health facilities. Here we are talking about the health centers as well as the district hospitals, because out of all the districts in Malawi, 2 do not have district hospitals. These are Palombe and Likoma. And we also don't have adequate equipment that has to be used by health workers. For example, we have reports in some districts where X-ray machines are not working, and at the moment in Malawi, when we are experiencing a lot of electricity blackouts, some districts do not have reliable generators. So these are some of the challenges which the Malawi health sector is facing. In addition to that, we have been experiencing theft of drugs, and that has been a challenge. And above all, inadequate funding to the sector, to the health sector, because we think the funding is not according to the Abuja Declaration, which says that at least 15% of the national budget should go to health. When you look at this, the same are opportunities. They have provided opportunities even to the private sector. We have seen of late a number of drug stores opening, because they know that the patients do not find drugs in the health facilities. And also, they know that we don't have adequate health centers. The other opportunity is on the electricity power. In rural areas where we don't have the national electricity grid, there is need for solar, and that is an opportunity where those who work in the area of green energy like solar, to plant solar panels in rural areas, so that when it comes to maternal issues, health workers stop using candles and cell phones, as well as the health workers are motivated to stay in. There are a number of key policies. For example, on the number of health centers, there's a policy that the radius between one health center and the other should be at least 80 kilometers, which is not the case at the moment, because other people still travel long distances to access health facilities. And also, when we are talking about the inadequate numbers of health workers, we are basing on the policy requirements. How many people should a doctor save? For example, we can talk about the extension workers, health surveillance assistants. One health surveillance assistant, HSA, is supposed to save 1,000 people in a community. That is one of the policies. We have a number of structures. For example, when it comes to systems, at the lowest level, where we have a health post, we have a health center. Under the health center, we have a health post. We can have a pharmacy. That is in terms of the infrastructure. But governance-wise, a health center is supposed to have a health advisory committee. Then health centers in the district, that is the primary level of health service provision. They form a primary level. At the district level, we have a district hospital, which has what we call the district health management team, which serves more or less like the health advisory committee to the district level. And that is the secondary level of health service provision. Then we have central hospitals. These, at the moment, are found in the regions of Malawi, except one central hospital, because we have one in the central region, which is Kamuzu Central Hospital, and in the northern region we have Nzuzu Central Hospital, and in the south we have Queen Elizabeth Central Hospital. Then in the eastern region we have Zomba Central Hospital, but we have one which caters for the whole nation, and that is the Zomba Mental Central Hospital. Government is the main key player through Ministry of Health. Of course, we also have some cross-cutting issues which are found in other ministries. For example, water and sanitation, which is under Ministry of Agriculture and Irrigation, because water has some bearing on health, but the main player is the government. Then we have civil society organizations. These are both local NGOs and international NGOs. Then we have Parliament, because Parliament approves the health budget, and specifically there is the health committee within the Parliament. At the district level, we have councillors. Councillors form what is called the Health and Environment Committee of the Council, and they also play an important role. The other stakeholders are the public, apart from the health workers themselves, doctors, district health officers, and the private sector, business people who sometimes support the health sector. I think the major do is that anyone coming to Malawi must understand the policies that are there, and also the national blueprint. For example, we normally have the Malawi Development Growth Strategy, which is like a guide within a set period, like 5 years, what is supposed to be achieved by Malawi. And also to follow the health sector strategic plan, because if you do things outside that, then it means you are not contributing towards the national development of the health sector in the country. And when one goes to the district, they do, which on the other side is they don't go and start implementing without going through the district structure. This is the district health management team. So that is a do. And we know that we have what we call the district executive committee. But before you go to the district executive committee, you must, first of all, meet the health sector, that is the district health management team. Then you go to the district executive committee. When it comes to implementation, there's need to periodically give reports to the district council, and periodically involve the district health office whenever implementing the activities, so that they are not outside program implementation. That is good for sustainability, because any program has a lifespan and it will expire. Then when that happens, the health system that is already as an existing structure will continue implementing the programs. We talked about drug safety.
Yes.
That is one of the governance issues. Leakage of resources. As the civil society that is responsible for health in Malawi, we have been advocating for more resources. But our worry is, do the resources, all the resources, save the purpose, like the drug safety? So I think there's need for more of monitoring and tracking usage of our resources. That includes finances and drugs in Malawi. The priorities, I think the major priority at the moment we think needs to be emphasized is the preventative health care services, because we have curative and preventative. We believe that if we can emphasize on prevention and we can prevent most illnesses, at the end of the day we can make a huge saving. In addition to that, we also need to identify areas that make us spend more, especially international referrals. We have been sending people outside the country. We are happy at the moment there is a cancer center being constructed in Lilongwe, but we need to make sure that within that center we put all the issues related to cancer that have been taking our money away. So that we train personnel accordingly, we buy equipment accordingly, and people should be able to get all the cancer-related services right here in Malawi.